Aishat Salihu now joins us for more on this. Aishat, what specific policy gaps currently exist in ensuring equitable access to menstrual products in public institutions like schools and prisons?
Thank you so much, Celestine. I agree with you that there are some policy gaps that exist, and most of those policy gaps stem from first creating awareness. I mean, these students go to school to learn from their teachers, right? And so that awareness has to be there, and the teachers also have to be equipped. They have to know that they have to have the knowledge. So I'd say it is important for the policy makers, especially in the education sector, to know that most of those teachers need to be trained on how to teach the young girls, not just the young girls, even the young boys too, on how to manage their periods properly and how to avoid period poverty, not just in schools, even in prisons. You visit prisons today and you realize that most of the female inmates there, they still have this, they don't have access to water, sanitary hygiene facilities. They don't have access to sanitary materials, just like it is also in schools, especially in the rural areas. So it is encouraged that part of our policies in the education sector or any of the sectors at all should include the bridging the knowledge gap, provision of sanitary materials, and also how these girls can understand themselves. I mean, they're children, they're girls, they're just learning about being a woman. So they have to have the right knowledge. So it stems from the curriculum, it stems from those syllabuses and all of that. So it has to be all inclusive. It's multifaceted.
How can government partnerships with private sector actors enhance distribution and affordability of sanitary pads for these children?
Okay, Celestine, you'll agree with me that there are some organizations that are out there who go on to carry out this responsibility of distributing sanitary materials to schools, to public institutions. So I believe once government comes on board with those organizations, I mean, some of these organizations are either sponsored or they are not sponsored. So I believe once they put resources together, government, these organizations, because I believe they are registered, they could partner with the ministries, departments, agencies that in the health ministry, right? They could partner and then give out these materials so that we can curb period poverty, and also train these girls, train the trainers, train them on how to make reusable sanitary materials, because sanitary materials are really expensive these days. So it's not just about providing for them, it's also about giving them the knowledge to make for themselves and also reuse when they have to reuse. How can they keep it clean? How can they ensure that once they're in this particular period of their life, there is access to these products? So it has to be something that is very deliberate on the part of the government and either at the non-governmental organizations to come put resources together, put heads together, and see these institutions that are lacking, this primary or secondary schools where we have children. I mean, the statistic is there, the data is there, so we know where these schools are, we know where the children are, we know where the girls are, we know what they need. So I believe with that, once they do that, we can curb period poverty and there will be adequate access to sanitary materials for young girls.
So we know that there's a lot of myth around, menstruation. So can you speak on the roles of teachers and healthcare workers in dispelling those myths? And how can, policy better support their training?
Okay, so like I said earlier, parents give their children to teachers. I mean, go to school, teach them what they need to learn. Apart from what they are learning from home, they should also learn from the teachers, right? So we know that there are lots of taboos, cultural misconceptions, myths, and misconceptions around period. So some cultures have it that once you're on your period, you cannot go to certain places. It's something that is shameful. And this is just a biological thing. It's a natural thing. So I believe once our teachers that are teaching these children, because they're the ones imparting knowledge to these children, once they know that, okay, they have identified the taboos, they have identified the cultural misconceptions about period safety and also menstrual health management, and then they can then, teach the children, okay, this thing you have learned in your culture. And also there should also be the involvement of the community, because yes, religious institutions and also community, because this is where some of these things thrive, this cultural misconception, this is where it thrives. So once they know that there's nothing wrong with a girl being on her period, it's a monthly activity that is expected to happen to a girl, a young girl, down to womanhood. I mean, something that shows that she's now a woman, and then it means it's a biological thing. It means she can have children amongst others. So once they know that there's nothing to be shameful about, there's nothing to stigmatize about, it's just a natural occurrence that has to do with the health of the child. And once it is properly carried out, I mean, there's also the prevention of diseases, reproductive health, also urinary tract infections that may come from when people do not know how to manage the misconceptions or how to manage their menstrual health properly.
Thank you, Aishat, for joining us at this time.
You're welcome.